Thank you for joining us today for the third of our virtual town hall series on the impact of COVID-19. I'm Heather Bagnall, your delegate in District 33. I first wanted to thank you all for your continued commitment to staying safe by staying home and practicing physical distancing and safe protocols, especially with the ever-changing landscape of this virus, which, as our own health officer said in a briefing today, we are learning about in real time. Last week, the governor announced the transition to the Safer at Home Phase 1 of the Roadmap to Recovery, but left much of the determinations of policy to the counties. Additionally, he made no mention of education or childcare, two factors that will weigh very heavily into the return of our workforce. During this pandemic, our Anne Arundel County Public Schools, our Board of Education, and the Superintendent have been actively collaborating with the County Executive and the other County Superintendents across the state of Maryland to address the myriad challenges posed by the early closure of school and the uncertainty created as we learn new information about the long-term impact of COVID-19, particularly on our youth who previously were not identified as a risk population. I am honored to be joined today by our esteemed panel, Anne Arundel County Executive Steuart Pittman, Deputy Superintendent of Academic Strategic Initiatives, Dr. Maureen McMahon, and the President of the Teachers Association of Anne Arundel County, Russell Leone. As you can imagine, our panelists are very tightly scheduled, so we will attempt to answer all questions, but if we can't get to your question on the call, we will circle back with you to make sure that you have the answers. If you have a question and have not submitted it in advance, please feel free to put your question in the chat or to submit it to the Facebook comments. I also wanted to thank my team once again, Max Pierce, Jenna Bachman, and Luke Tudball, who are working hard behind the scenes to once again make me look far more tech savvy than I really am. With that, I am honored to introduce our county executive, whose community first approach and regular community engagement and input have won him accolades from both sides of the aisle. County Executive Pittman, I truly appreciate you joining us today, especially given the strains of this most recent executive order, the breadth of which I suspect took us all a little bit by surprise.
Yes, thank you, Delegate Bagnall. Can I call you Heather? Because
absolutely,
that's what we do privately. You're Heather to me. You can call me Steuart. Yeah, thank you for putting this together and all the town halls that you're doing. Communication is obviously really important right now, and there's a lot of uncertainty, and it's a really difficult time. The focus for the county, as you know, has been on the one hand fighting the virus, which is that battle is being led by Dr. Nilesh Kalyanaraman, who I just got off the phone with, been in contact with a lot lately, and then there's all the work to protect the residents of this county from all of the economic fallout of that battle, really, and that is being led by our whole staff, but particularly our Deputy Chief Administrative Officer, Kay Bodgester-Brown, who oversees Health and Human Services. So you've probably read about the work that we're doing on nutrition and setting up food distribution centers. And there's a map on our website now of all of the food distribution, both the school districts and senior centers and the churches and the nonprofits and everybody. And then we have this problem of eviction that is likely to happen at the end of the governor's ban on eviction. So there are a whole myriad of housing issues that we're having to confront and that are coming. So we have an eviction prevention program. And then there are all the gaps that the federal and the state governments have left in protections for people. We're actually we're planning to launch an excluded worker humanitarian fund to help workers who aren't able to access federal unemployment insurance. So there's a lot of work. Government is working, cutting red tape and working as fast as we can everywhere. And then we've also we've collaborated with the school system on a family assistance collaboration that's just getting started to address some of the issues that I think we're going to talk about in this town hall. Do you want me to stop there, or do you want? Or?
No, you please continue, because I know that you have had you've been doing yeoman's work, because so much of the decision making has been left to the counties. but one of the things that I think that has been highlighted by this pandemic is the fact that every decision that we're making isn't simply one decision. It's a myriad of decisions, and that we're constantly looking at the unintended consequences of every single decision that we make. I know when we were talking about the schools, even when we were in session, the first question was about the food insecurity, but then there's also the digital divide, and then there's also the short-term socio-emotional impact of the stay-at-home order, but then also the long-term mental and emotional impact of just sort of seeing this routine so vastly interrupted for young people who are in various developmental stages.
Yeah, and it's been the state government and the county government and the school district have an interesting relationship, because the school district is actually some would describe it as a state agency, but more money comes from county taxpayers than the state taxpayers for the schools. And so we do we do our contribution to the school's budget, which is most of the budget. And I do stay in touch with Dr. Arlato, but we don't define the policy for the school system. That's done by the school board, which is partially elected and partially appointed. So the lines of authority are running all over the place, and the decisions to close schools were made by the state. But the child care situation is also being controlled by the state. And that's an area where this most recent decision, the announcement that some businesses would be reopened who are not essential businesses, created a real mess for families. So the governor has said that child care centers all closed. And then they reopened some only to handle the children of essential workers, of essential businesses. So now that we have non-essential businesses operating, those parents can't get childcare. And we're waiting for the governor to step up and solve this problem. But it's not a very family-friendly situation right now. So we have to confront that as we reopen. We did not expect to be making the decisions about when various sectors of our economy opened. That was announced last Thursday by the governor, and last Wednesday, and we had 48 hours. We knew we needed to act quickly, and so we took a more cautious approach than was allowed in the state, and that's created for all counties. I mean, as you know, the Central Maryland counties went slower, some slower than us, some faster than us, but we were sort of in the middle on that, and so that's created a sort of chaos where not only counties are now making decisions that the state was making last week, but within counties, municipalities are making their own decisions. So it's really hard to have a consistent approach to fighting the virus when local governments are moving in all sorts of different directions. So I'm in regular contact with the county executives in the Big Eight so that we try to operate across boundaries in a similar way. But we have got to get a seat at the table with the governor to be able to, in advance of these announcements, be a part of the decision making. He's got committees of businesses and various sectors of business advising him, but local government's not at the table. There's a weekly call where you can ask questions, but we're pushing for that. We would like to get that and more transparency with what the state is doing. So it's been a frustrating time for all of us, including in government, every level of government. But overall, I think we're all functioning at a much higher level, moving faster. And I actually believe that, we say Build Back Better. I say that in Anne Arundel County. That's our theme for rebuilding out of this and taking the lessons that we've learned and the opportunities that have presented themselves to actually create a better economy than we had before, one that values the working people at the bottom end of the economic scale, one that has a safety net so that when we have incidents like this, people have health insurance, people have a roof over their heads, people have food. And so we're building that out of this pandemic. And I believe that people really are coming together and they understand that we're all connected now in ways that they may not have before, and that we'll come out of our homes and having beat this thing and feel good that all of us actually participated in solving the problem. So that's my positive, optimistic view of all of this.
And I would tend to agree. I think, you know, we're challenged right now because we're having to react in real time. But it's really sort of identifying gaps that we knew were there, but we can't look away. County Executive, I wanted to ask if you're able to stay on this call, we can take questions at the end. If not, you know, we'll sort of jump to questions and jump around. You're able to stay?
Okay. Yep.
Fantastic. Thank you so much. I did want to acknowledge, we also have on this call Adam Spangler from Congressman Brown's office, who's taking information back to the congressman. We also have Kai Bajas de Bruin from the County Executive's office, as well as Liz League from the CEO of the Arnold Greater Severna Park and Arnold Chamber of Commerce. With that, I wanted to turn our attention to Dr. Maureen McMahon, because one of the things that we've been talking about a lot is these gaps, these equity gaps and opportunity gaps that are expanding in light of COVID-19. That, you know, they already were in existence. We knew that, but it feels like we're a little bit sort of, you know, on the back foot in terms of how we're going to address this, and even going forward. You know, the county executive and I talked last week about this childcare issue, and how we were going to address it, because the schools are closed, the day camps are canceling, and the reality of women as primary caregivers raised quite a few alarm bells last week when childcare wasn't identified as an essential service for moving forward in our recovery.
Mm-hmm. So I would say I understand the question, Delegate Bagnall. It's a good one, and it's a good thought. And with equity at the center of everything we do in Anne Arundel County Public Schools, it really starts first with safe and healthy children and families. And so initially what I'll say is the first step in equity for us was to feed the children. And so, you know, in the last 39 days from March 16th to May 12th, the food and nutrition service personnel of Anne Arundel County Public Schools have served over 1 million meals. It's simply amazing. And that is the first step. That says students can be ready for learning if they've been fed. And then from an equity point of view, if you're going to connect them with e-learning, they need devices and they need connectivity.
Yep.
So we are acutely aware that that's the issue right there. So starting really early in April, almost less than 2 weeks after we went out for school closure, we had the survey on the street and we were reacting to families in need of initially smart devices. So while many of them had phones, telephones aren't the easiest way to connect to the internet if you're actually doing schoolwork. So while that works and you can download the materials, you really do need other devices. And so to date, we've given out, actually signed out over 10,000, approximately 10,500 Chromebooks to our families across Anne Arundel County. And we continue to do so. That's not over. If a family needs a device, they need to just let their teacher and principal know, and we will work with them. We continue to work heavily every day. We're harvesting new Chromebooks out of our schools and signing them out to families. That's one step of the connectivity. The other step, of course, is the internet. That's tougher for many. We have now been working diligently with Comcast, Verizon, and BroadStripe, the 3 internet service providers in Anne Arundel County, to make sure family by family, staff are calling on family by family and walking families through the many, many opportunities that those internet service providers are now offering families, whether it be free or at a very reduced price to get connected to the internet. Last week, even Comcast was pulling cable to some homes that were not serviced by them so that we could connect a family with a special needs student. I mean, it is really amazing what the business partnerships, county government, schools, business partnerships together are doing, one step at a time. And I will tell you, we have less than 1,100 students right now that are not connected to e-learning. That's amazing. We have 85,000 students in Anne Arundel County Public Schools and only 1,100. We're not proud of 1,100 because we want it to be none, but 1,100 is right now amazing, and every day it drops. And that's because of the good work of so many people coming together. I will tell you, of that 1,100, over 500 of them are elementary students, and they are serviced with print packets, learning on the go packets that go home weekly. So it's every day we get closer to saying every child is connected. And that's part of equity. Until they're all connected, we don't feel like we're giving all of our students, you know, the fair chance. But on the other hand, I have to tell you, that number of students, if we were in brick and mortar schools, we would struggle with connecting all students too. There's a certain number of students who really struggle with being engaged and connected. So day by day, that number gets smaller. I'm excited by that. Now, childcare. Childcare we know is an issue. Right now, people are home and they're caring for their children and they're working and they're trying to help them learn. That's an enormous undertaking.
Yeah.
It's a lot. And we know that. And so we recognize that child care moving forward, whether it be for the summer or whether it be for the fall, child care is going to be an issue that we have to work into as one, as you said, one of the myriad of variables that absolutely matters when we make our plans for reentry, reopening as a school system.
And one of the things that we've talked about a lot on these town halls is the sort of the Venn diagram of our local, our state, and our federal, our federal governments, and the coordination across those, sort of unsiloing, if you will, those different agencies. How much sort of statewide coordination are you experiencing? Or is it really more county by county and focusing on local jurisdictions?
From the school system, I can say that our superintendent, Dr. George Arlato, connects with his colleagues across the state, his peers, other superintendents of the other 23 LEAs, as well as the state school superintendent, multiple times per week on conference calls. They are absolutely connected. So the good news is that we are all in this together. Although everyone has some autonomy, we're also trying to operate together in this because it is Maryland's young people that matter, right? So he is on those calls up to 3 and 4 times a week and brings that information. And then, of course, he and Mr. Pittman and others are in constant contact as well. So we feel like the sharing of information is really healthy at this point in time. The challenge really is, and you hit on it earlier, there's so many moving parts, so many variables, all interconnected. And that's where the next real big challenge is for us moving forward.
And as you're looking at the fall, do you have predictions? I know that Dr. Salmon had introduced a few different options of what sort of the statewide policies would be, but again, it sounded like these were potential guidance, but not necessarily implemented the same across jurisdictions.
Yes, you're correct. She has a recovery plan, and so with that recovery plan, you can see models in there for learning and for instruction and for both face-to-face rotational days, maybe some virtual learning, some blended learning, some hybrid situations where groups of students are face-to-face and others are at home, and that rotates through the weeks, through the month. There are all facets and variations on a theme there. And all of that has to do with the social distancing, a mandate that we're not exactly sure what that'll be at the time, but if students need to be further apart than 30 in a classroom will allow, then of course a different mandate of how students come to school will have to be in effect. That's true for both the summer and the fall. We are working behind the scenes already, and we're going to be engaging more stakeholders in the next few weeks to make sure that the voices of all are heard on this. Certainly the biggest challenge right now is some of the variables are not yet well defined. What will social distancing mandates look like, and where will we be come September might be very different than what they are now, you know, coming up on the beginning of June. But we are ready with all the various permutations. Of course, the details include childcare, they include transportation, they include feeding children. All of those variables have to be included in the big discussion of actually teaching and learning of the fall.
Absolutely. And I wanted to go over to President Russell Leone and talk a little bit about the experience of our teachers, who I know are desperate to get back in the classroom. They miss their kids, and there are some very real struggles with even training on what e-learning looks like, you know, what the role of our individual teachers are in terms of that that online world. And I will say, and this is my own personal opinion, you know, not my office, but I'm not loving the talk about the Bill Gates online tech model. And so I'm hoping that that's not the direction that we're looking.
So Heather, thank you so much. Before I begin, I want to just acknowledge our families, because through all of this, they've really have become partners in our education of our students in ways that they had not had to do before. It's a whole new world, and it's been frustrating at times, but it's also been great to see what people are doing to come together. You did mention about the training and you know, getting up to speed with the format that we're in. As you can imagine, it was overnight. And so there was not enough time for the school system to do full trainings for everyone right away. And so a lot of our teachers were doing some of that, you know, to fill in some of the gaps until the trainings could be provided by the school system, which they did, and they provided quite a bit for our teachers to provide that support. But as you can imagine, and I know you said, you know, our teachers do miss their kids so much, because the profession that we have is about the relationships that we build. It's not just about, you know, giving kids an assignment to do and, you know, they're overworking. There's a whole lot of collaboration. There's a whole lot of support and ideas sharing on all different levels, whether it's kindergarten on up to the high schools. And so that's been a challenge for not only our teachers, but our students too, because learning is not the same as it was, you know, 2 and 3 months ago. There's not that collaboration that is happening with the whole class. A lot of times, and you can imagine juggling schedules, kids juggling schedules of their different classes, especially in the secondary level. There's a limited amount of time they can check in with all of their teachers and still get to all of them. And so they have to make choices as to which class they're going to check in on at different times, and to be able to do that. So.
And I really appreciate that. I can't imagine the challenge of just having to completely pivot how you're operating, and the added challenge of not being able to physically collaborate with the other people in your profession. All of that had to move online as well.
That did, and actually I talked to a lot of teachers, and they have created their own Google Meets to make sure that, you know, outside of their classrooms that they're meeting with each other, so that they can do that collaboration and you know, and sharing ideas. They've got all kinds of different communities that they've built sharing not only ideas within their group that they work with in their school building, but across school buildings. They've really cropped up to share information and to support each other that way. And also, it's been a challenge because I think I mentioned it before, but the level of people's familiarity with the technology also varied. So that was another factor that we were working with as a profession, because there were plenty of places where the technology was infused into the classroom on a daily basis, and other places not as much. And also it depended on the school level. I mean, as you can imagine, trying to do a virtual classroom lesson with a group of 5-year-olds looks very different than it would with, a group of 16-year-olds.
And just sort of looking to the future, because funnily enough, I had a conversation with our superintendent before COVID-19 regarding that for our listeners, there's a disparity in how the state views absences. They don't differentiate between excused and unexcused. So it sometimes unfortunately impacts the counties. So it's a little in the weeds, but we were talking about that, trying to see if we could address it at the state level. Because one of the challenges for some of our county students is that they have family in South America. It's very expensive to travel to South America, so they have these extended holidays, which are excused, but the way that the state grades and the county grades are a little different on that. But we were talking about the possibility of distance learning, filling that gap so that they could actually be participating. And that was before COVID-19. That was before we had any idea that this was going to happen. So looking to the future, are there gains that you see from the technology having to evolve so quickly?
So yeah, I think there are definitely gains. When you're thrown into this space, you really do have to figure out what creatively that you can do to meet the needs of the kids. And we've heard stories from teachers who are saying, I've got some kids in my class that are checking in that on a level that they had not seen before. So there's the other side of it too. We've got some that are not as comfortable with it, but it really did shine a light on some of those kids who do learn in a different way and do respond in a different way. And I think that moving forward, we certainly need to use this lesson that the world has thrown at us to say, this is another tool that we have to really reach our students that maybe we've had difficulty reaching before.
And Dr. McMahon, if I can turn back to you, we had a question about how we're addressing some of our special needs population, because I know that's a whole added challenge in terms of the distance learning, addressing those individual learning plans and some of the gaps in that one-on-one educational experience.
Right. So as we moved in through the initial stages of COVID, we moved to a place where from the state down, we were directed to work with each one of our families with special needs children to create an individualized continuity of learning plan, an ICLP, if you will. And really what that is that's a new agreement in place of the IEP to say what we're going to be able to do to support their needs, aligned with their IEP, but this new agreement during this time away from school. And so we have over 98% of our families have signed the agreements now, and we are working diligently with our special educators, their teacher specialists, their aides, through Google Meet, through Google Voice, which is the telephone opportunity that we have. Any way possible, we are helping caretakers at home, whether that be parents or guardians or caretakers, to actually help their students. So we are doing everything to meet their needs as best we can while we are away from them. that is a struggle for many of our students, being away from them and not being able to be in close proximity to them to help them. But we are doing our due diligence to try to meet their needs in these extreme circumstances.
Well, I think that's, in some ways the best we can do. And this is an actual crisis where we just are innovating every day. And it's I'm not sure that that's gotten enough sunshine. That's a fairly astounding ratio, 98%, when we've only had 3 months to develop these protocols. It's not a lot of time.
No, everything is on fast forward right now, and yet at the same time we're trying to do everything with high quality. We're trying to make really good decisions on behalf of children. So that is a challenge, and we're really very proud of our staff and also very appreciative of our families who are stepping up to be really great partners in this endeavor with us.
And County Executive, I think this is a question for you, and it's probably also a question for our federal folks in terms of what we need, but how are we going to ensure that childcare doesn't collapse? Because as a business model, it's very small margins in terms of return. So it was, even pre-COVID, it was fragile. So how are we going to not just reopen childcare so that it's sustainable, but what do we need? Like, what do we need as a county? What do we need as a state to ensure that our childcare industry doesn't collapse under the weight of this crisis?
Yeah, I think when all childcare centers were closed as non-essential businesses, that sent a chill through the whole industry, of course, and some are paying rent, not all. Some are paying insurance. They have expenses in addition to having to lay off staff, who in most cases probably are hopefully getting unemployment insurance. And then some came back on to be able to serve the essential workers a short time after that. And they're all operating at far less than the levels and far less than the revenue that they were getting before. And so they're hanging on by a thread. And this does shine a light on the need for childcare and on the need for those small businesses to make ends meet, to be able to continue, because when we lose them, we realize how valuable they were. What we're doing as a county is watching carefully and waiting, while also advocating at the higher levels of government. The federal government can provide resources because they can borrow money, basically. The fourth bill that the House is considering right now will continue to add, to build the safety net, really. The third bill, the CARES Act, has been helpful, and we do have some federal money that the county has that we're using to fill these holes, Band-Aids, basically, when the feds fail and the state fails and we need to step in. So as things reopen and more people need childcare, and when we get to the point where kids are back in school, and then they're gonna, before that it's even worse, but the system has to be recreated from where it is now, and it's almost crumbling. And so we have to step in with assistance. We don't know as a county yet exactly where we're gonna be needed, and then we have to look at the resources we have to help. But I think we are, as far as I know, maybe one of the only countries in the industrialized world that does not ensure that families have childcare so that they can work. And we're going to have to build that system.
And I know over the last few years, especially sort of statewide, there's been a shift from small family childcare to much sort of larger, almost schools, or more industrialized childcare centers, and the regulatory authority shifted as well. Do you foresee a shift, given that we're probably going to have limits on capacity, that we're going to have protocols, and we're going to have liability issues that we still have to resolve? Do you see a shift in regulation? Do you see a shift in authority, or are we even there yet to be having that conversation?
I don't know what's going to happen on regulation. I think that I think it's likely that at least in the short term, there's going to be some relaxing of some regulation to allow the service to be provided. I mean, that's what we're finding. That's why we have this emergency declaration at the county level, is to allow us to do things that we might not be allowed to do according to the rules that government is under during the crisis. And I hope we'll still have that authority next week. There's some on the council that are trying to take it away right now. But what it does is it cuts red tape. It allows government to act when we need to act. But what we're seeing already is that folks are using the internet to find childcare, right? I mean, there are young people who are home, who are not in school, are not in college, and a lot of unemployed people. And so people are finding babysitters online, and that's not regulated at all. And so, yeah, the market is going to have to be part of the solution, but the government is going to have to be smart about, making sure that people can operate in this environment, and at the same time, make sure that kids are safe.
Mm-hmm. Well, and I think we're very fortunate in Anne Arundel County to have Dr. Kalyana Raman, because I know that every decision for business is coming through the advisement of our very, very proficient health officer. So there's always a fear when we talk about relaxing regulations around childcare. But I know that would be through the filter of the health officer and the health department.
Yeah, and they have a lot of decisions to make very quickly right now. We're running some things by the health department right now about just stepping back away from the childcare situation and the kids. Reopening retail businesses and beauty salons and barbershops and trying to get away from this, fire code standard of 50% of fire code capacity, which has nothing to do with health, and move towards something that has got more to do with social distancing and protecting people from a virus. And so, we're running all that through him. He's becoming sort of the policy prism through which everything runs in the health department. And that's a good thing, because, at the end of the day, government exists to protect the public and protect the health and wellness of the public.
Absolutely. I think this question might be for Dr. McMahon and also for President Leone. We had a question come in. We know the virus is contagious, but there is so much that's unknown. In fact, we're finding out more about the long-term impact, especially on young people. This disorder that's appearing 4 to 6 weeks after they've recovered. The deaths in our county are around 50 outside of the nursing home community. Is there consideration for the effects of the social and emotional issues for these children that are not in school? They've had their activities restricted for 25 weeks at a minimum. Our students are facing challenges they've never felt before, and being in isolation is a change they're not familiar with. So how are we looking at addressing those needs going forward?
That's a great question, and you've hit on something that's near and dear to our hearts, because although school is a place for learning, it is a social place. It is a place where young people connect, and they learn how to communicate, and they learn how to navigate the waters of social interaction, and they learn how to form community and even understand the beginnings of government, right, as young citizens. And so it's a big deal that they're away from school. So as we move forward, even as early as June, we're offering professional development for our teachers, social emotional support, but also trauma, we call it trauma-informed care. How do they become, in some cases, some of the first people to help students who are struggling emotionally? And then our counselors in the schools, they've been engaged since we've gone out. They've been engaged every day, reaching out to families, reaching out to students, coming into the Google classrooms and talking with students. And really one-on-one and in small groups, making sure that we're really aware where the wellness is and where the kids are struggling. So yes, it is part of everything we've done since we've been out, but it's also really part of the professional development moving forward for our teachers. And then we also have an opportunity for families coming up in June. The date is not yet set, and it might be several dates, but the idea of having a virtual conference, and that virtual conference will be on trauma-informed care. And that'll be something we offer our educators and our families, because we know the social emotional wellness is key to a young person's livelihood, and also then key to a young person's ability to learn.
Thank you. And President Leone, I'm actually I'm gonna add on to this a little bit, because even before COVID, there were studies and conversations around the long-term emotional impacts of some of the drills that we were doing, you know, some of the shelter-in-place drills, and whether they were really making children safer, whether they were making them more afraid. And you know, I'm concerned that this is just another layer of fear. And what are the resources that teachers are getting for their students, but also for themselves? I mean, I see you actually becoming emotional even as we're talking about this. So I know that you know, that's from a passion standpoint for students. I know that this, you know, this is taking a toll on teachers.
No, you're absolutely right, and thank you for acknowledging that, because this is impacting everybody, and the teachers. When this happened, you took away part of the essence. I mean, not you, but you know, the world kind of took away part of the essence of who we are, because we thrive on helping our kids, helping each other, and having that really personal connection that can't be really replaced when we're all sitting in our own homes. And so moving forward, and I'm thankful that Dr. McMahon has acknowledged this as well, we do also have to provide that training for our teachers and that support for our teachers. And when I say teachers, I mean our teachers are our counselors, our school psychologists, they're all in our ranks, and we all work together. And so these are the things that we have to make sure that we're trained well, and given the tools to help support our kids as best we can. One thing that's happening right now to help the kids with their social emotional, a lot of teachers are doing their Google Meets, and they set aside, it's not just lesson time. It's time for them to share. It's time for them to interact with each other within that, and talk about some of their feelings and some of their things they're experiencing through this whole process. And I think that's been really, really important for the role we've been playing to help support our kids and our families, because sometimes we have parents of the really young kids who are sitting in on those classes, and you know, they're helping to navigate the technology for the kids, and so they're hearing some of it as well.
And Dr. McMahon, as we're talking about this, I think sometimes again we get a little siloed, and we the community forget that the support staff are such an important part of the educational culture. And for sometimes for those students who nobody else notices, the support staff are actually really integral to their emotional development. And so these resources that we're providing teachers, is it for the entire educational community as a whole, or is it a little more siloed in terms of teachers and admin?
No, it is for the whole community, and that's a good point you're making, because we recognize that in some schools, you know, it's the food and nutrition service person who says hello and how are you and knows the student and their family, and that is the meaningful person in that child's life on a daily basis. Or it's an admin assistant in the main office, or a custodian, or the
bus driver, the custodian, right, or the resource officer.
Right.
Yeah.
Right. We never know. And that's so important. And so, yes, the PD that we're offering now, the professional development we're offering now, the beautiful part of this is, because it is online, we have everybody together. And so we have all the various people sitting right next to each other in the same PD, on the same Google Meet, taking that professional development together, and it has brought us closer together as a family, as an AACPS family. And so it's important that you ask that question, and we're very proud of the fact that that's one of the good things coming out of what, you know, ultimately was such a shock back in March. One of the good things is we are coming closer together because we're able to engage shoulder to shoulder in ways that before we couldn't as easily. So yes, they will have the opportunity to have the trauma-informed care professional development, as well as a lot of different professional experiences all summer long.
Thank you. That's really exciting to hear. I think this is probably going to be a question for both Dr. McMahon and our county executive, Steuart Pittman, and all of us, because the question that came in is, what plans are in place to ensure that broadband will be available to all students in a way that's more accessible and equitable than students in a parking lot doing their work or taking an AP test or whatever the tasks are, because we know that this was, we had to figure out how to do it quickly. But long term, what does this look like? And what do you need from the state? What do you need from the feds? How do we get broadband more accessible?
So maybe I'll take a first stab, and then Mr. Pittman, I know you have a broader answer that you could provide. One thing we know from the very beginning is that the students around the county don't have equal access. Some of our communities that lack cellular service or other service, it's just a challenge. And then in some cases, cable is missing to homes, right? It hasn't been pulled yet. In other cases, it's a financial barrier. There are all different pieces of the spectrum here that keep somebody from being online in a reliable way. So we know that even with our data that I shared earlier, that 1,100 families, we know that family by family, we're chipping away at that. But ultimately, it just needs to be easier for it to be kind of ubiquitous. You know, in other words, if you are in Anne Arundel County, you're able to be connected to the internet. We know that ultimately is what we want. Along the way, though, we've come a long way, and I've got to do a shout out to all the various partners that have been helping us, including county government and the internet service providers themselves. Everyone has joined arm in arm in this effort to connect families, and I know going forward it'll be easier because going forward there'll be a more robust plan. But I know Mr. Pittman has more to say about that.
Actually, this is one of the reasons why we, I called Dr. Arlotto a few weeks ago and said, look, we've collaborated between the county agencies and the school system in our closing the opportunity gap, the achievement gap together. And we've collaborated on the mental health task force. Both of those are ongoing. My staff has come and said, and some in the public have said, both the school system and county government are working on the same issues, and sometimes at the staff level they're not communicating and helping identify gaps and sharing data. So that's why we put together this collaboration. And if it's okay with you, I can see that Kay is with us, and Kay Bodgester Brown, if she could answer for me about some of what you're hearing, Kay, about this issue of broadband, of how to get the internet access.
Sure. Thank you, County Executive, and thank you, Delegate Heather Bagnall. With regard to the family assistance collaboration, we've got a very small group that is working together to discuss many of the issues around the internet and making sure that folks have these services in their homes. And there is another group called the Interconnectivity Group that started before us that I learned about today that is also working on this. And they're working on areas that are focusing on the Title I schools. There's a couple of initiatives that are related to working with the internet providers to explore how different programs that people can qualify for, and also looking at relaxing some of the issues that kind of get in the way of individuals either applying, whether it's paperwork or documentation that might turn some families away who might be fearful of having to provide different documentation. And then also setting up different programs that would allow for sponsorship of families for an extended amount of time. So they're trying to get outside the box and be creative. I don't want to take credit for that, because this other group did actually come up with some of these ideas and are working directly with some of the providers. And what our group is doing is going to offer support to them. And if we need to, you know, lift that up and get the county executive's office involved and look at the ways that we can support those efforts, then we will definitely do that.
Thank you so much. And you know, from our perspective, I think if this virus has highlighted anything, it's the fact that it is time to determine Wi-Fi as a utility. That it's a necessity now. It's no longer a luxury. It's no longer a luxury item, and that's not quite something we can do on this town hall. But you know, we'll put it out there and see what happens. We are coming up on the hour, and I want to be cognizant of everyone's time. But I did want to give our panelists an opportunity to, if there was anything that we didn't touch on that you wanted to put on the public record, to give you that opportunity. And we'll start with President Leone.
Yeah, so I think one thing that we really haven't talked about in terms of connectivity, families that have multiple children, this has been a huge adjustment period for them, because if they have 3 or 4 kids in their household and they're trying to connect into all of those classrooms and they only have the one device, then that becomes a challenge. So that's something else that, you know, even as we're moving forward and into the fall, if digital is going to continue to be essential, we've got to find out additional ways to help support those families as well.
Absolutely, thank you. Dr. McMahon, was there a final?
Yes, I just want to send out a big thank you. Thank you to our families and their young people. Thank you to our teachers and all of our educators and the staff of Anne Arundel County Public Schools, because together we are better, and together we're moving through this. And then all of our partners, county government and the police and all of our partners across the county. It has been wonderful to link arms in an effort to do right, in our case, by our young people for the future of Anne Arundel County. And we will do right by this, and it will get better and better as we move from e-learning now to a more robust e-learning offering, or hybrid or face-to-face, whatever the case may be, into the fall.
Thank you so much. And County Executive Steuart Pittman, you have the final word and your ask if there's something you need from us.
Yeah, I think maybe the one piece that we could have talked more about is mental health, not only for the kids, we talked about that, but also for the parents. And I got twin 10-year-old boys at home, so it's a challenge. But through this whole pandemic, the stress that people are under is extreme, and we had a town hall on that very issue, and I don't think you can overstate it. And as we pull out of it, actually, we've been advised that by a disaster relief psychologist that it sometimes can be even worse. You know, once the crisis is when the crisis is happening, we're all addressing it. When things start to come back to normal, but they're not quite normal, people are confused about why that is and have real challenges. So I would encourage people to contact the Mental Health Agency of Anne Arundel County. There's a warm line where you can really call and just ask questions, talk to somebody. There are people who are in the same situation that you are. Now, the number I have here for the crisis, oh, that's the crisis one line. We'll just go to AnnarondCounty.org and Mental Health Agency, and there are a lot of resources there that can help people out.
And my staff is going to put it in the chat as well.
Okay, great.
Online. Thank you so much for bringing that up. As you know, that's a real passion for me as well. It's very close to my heart. And it's also a good segue because we are scheduling another town hall. We're still working on the timing, but we are doing a town hall with Congressman Brown on the unemployment situation, which has caused heartache and mental health crises for over 100,000 of our Maryland residents who are still stuck in this system. So we'll have details about that coming up. I just want to thank my panelists once again. Thank you all so much for being on this call and for being so forthcoming with information as we're working through this pandemic. And I would encourage anyone to go to my website. We have a repository of resources at heatherbagnall.com/COVID-19. There's also a number of resources on the Anne Arundel County website for food instability, for housing, for paying your utilities, and we will get through all of this together. So thank you once again, everyone. Thank you, County Executive. Thank you, President Leone. Thank you, Dr. McMahon. And thank you to our teachers, our healthcare workers, our essential employees, our custodians, our grocery store clerks, and everyone who's been doing the good work to get us through this crisis.
Thank you.
Thank you.
Thank you very much.